Hello, everybody. Happy Monday. Welcome to another episode of Learn with Flo. We're having to try out another little camera angle here as I have to hold my phone because I've not replaced this crappy tripod yet, but we're making it work. So welcome to another episode. I'm really excited to continue to build on the conversations we've been having throughout the month of January. We've been diving into this theme of really unveiling the truth behind the two different styles of medicine that we all have access to today. I found that in conversations with patients and clients behind the scenes, there tends to be a lot of confusion around the differences of healthcare opinions, healthcare directions. And so I wanted to make it super easy and also kind of expose the truth that I feel like a lot of people are too nervous to talk about. I'm like, let's just call a spade and throw it all out there because I'm truly confident that the more education that people have, the more confident you can be trying to navigate the right healthcare experience for you. That's really what I'm all about. Is I don't care what healthcare experience is right for you. I just want you to have the right healthcare experience. And I think a lot of people are just a little bit overwhelmed or kind of have a confused or kind of conflicting landscape. So here we are. We're exposing the truth of it all. You know, that's how I do here at the Lowdown. And my hope is that it always leaves you as the patient feeling more educated, more inspired, and really more confident to really ask for and seek out the right system for you. So throughout the month of January, if you've been with us, as a quick little recap, we've been talking about the two distinct models of the healthcare industry today. Each of them is well equipped for certain types of treatment options and for particular people for particular purposes. Okay, so know that right off the bat. This is not a competition. This should be more of a collaboration because there's certain instances where more of our conventional healthcare model is very appropriate, and then maybe more instances where more of our functional medicine alternative is more appropriate. And it's just a matter of understanding those nuances. So we have one model of healthcare that really helps us move from a state of dying to surviving. I realize it sounds morbid, but that is what the conventional medicine system is built on. That's what it does really well. That's what our kind of like conventional medicine schools and curriculum are built around, is helping make sure that individuals are not dying, but they are surviving. And if they're surviving, they've done their job. Okay. So in this state, it uses the toolbox that we're going to see here are going to be more imaging tools to be able to find like the big and scary stuff, right? You're thinking like x-rays, MRIs, scopes. We're looking for the life-threatening type of things, as well as maybe using things like pharmaceutical strategies to really band-aid the symptoms in the short term, right? That is the goal of conventional medicine, is to triage the situation, to take someone from dying to surviving. That's it. So of course we're going to use band-aid solutions because that is the goal. The goal is not to like find the root cause and heal from within. The goal is like, where can I stop the bleeding? Okay. The goal here is just to make sure that you're sheerly alive. Then we have the other style of medicine that you have access to as well too, which is more of a functional medicine approach. This is moving someone from surviving, right? So now we take over where conventional medicine left off and we move someone from more of a surviving to a thriving model. Now in this, the toolbox is completely different. We're not using these big scary these imaging scans and scopes to find big and scary stuff. That's not what we're about. We're taking someone that's already very much surviving and trying to move them into thriving. So we're going to do more comprehensive testing to identify the root causes of issues, of things that you can't see on imaging, right? All of that comes back, well, ship shape. That's awesome. We have to sometimes rule out the big and scary stuff. But what about the microbiome? What about toxin exposure? What about hormone imbalances? What about nutrient deficiencies? Like, we're going to use a toolbox that follows up with a more personalized approach using things like food, lifestyle, mind-body medicine. We're not just making sure you're alive. We're making sure that you're truly living to your fullest potential. Okay. So these two models of healthcare and these two toolboxes are used in very distinct scenarios, and both of them can be equally beneficial, but what I see more often is people are getting extremely frustrated. They're feeling dismissed. They're feeling hopeless because they're out there trying to use more of that conventional medicine dying to surviving model. They're trying to use that for chronic conditions in which they're really looking to thrive. And so they're feeling frustrated when all they leave with their practitioner's office is like, oh, another referral to another specialist or another prescription medication. I'm like, that's their toolbox. That's all they know. If you're looking for something different, you have to step outside of that model completely, because you're just going to get more of the same thing no matter what practitioner you go to, right? So don't get frustrated by that. And if you're, like I said, interested in hearing more of the nuances of that, that was the first 2 Learn with Flo episodes of January. So go back to those episodes and definitely dig in more, because today I really want to build on this concept of understanding these 2 different strategies. How are they different? How are they also, like I said, beneficial in their own right, but also very different? Okay. And when we talked about the diagnostic toolboxes last week, we talked about the differences in lab testing that you'll get from conventional to functional medicine. We also talked about the differences in like imaging, and we also talked about the difference in overall mindset, right? With those 2 different diagnostic toolboxes. And those 2, like I said, as we established, they're wildly different from each other, because one is looking to just stop the bleeding and the other one is looking like, what's the root cause of the bleeding, right? So the same goes true for both of these models as they try to navigate the world of nutrition. I'm sure you have felt this before, depending on what types of experiences you've had, either working with providers or working with other professionals and talking to individuals about nutrition or its contribution to our overall health and wellness. And I think there's, again, a lot of mass confusion, a lot of overwhelm, and honestly, some people are even leaving with worse health outcomes when they're not using the right nutrition approach based off of the model of medicine that they're operating out of. Okay. So let's just do a little bit of some like situation analysis so you can see whether you have kind of experienced this first and foremost. Number 1, have you ever had the experience of where maybe you have waited 6 weeks to get into your primary care provider's office because you have some health concerns around brain fog, weight gain, anxiety, some chronic gut issues, right? And finally you get this appointment with your PCP and you get hit with some like generic advice where they're like, well, have you tried to eat less, move more? Or have you tried to count your calories? Or I kid you not, I had one of my patients come to me who said, she goes, my doctor literally told me, take whatever you're eating right now and cut it in half. Excuse me? She's like, she didn't even ask me what I was eating. She just said, if you're having weight loss issues, whatever you're eating right now, take it and cut it in half. Wild. That literally set my head spinning. And that is like a real situation that is happening today. That is not outdated advice. That is exactly the scenario that's happening today when we're getting nutritional conversations from more of a conventional medicine model. Or you go in and they're like, oh, drink more water because you're probably just thirsty when you think you're actually hungry. So many patients are going in and they're feeling dismissed. They're feeling overwhelmed. They feel like they were even like gaslit in the process. They're like, what just happened, right? Because they almost are made out to feel like you're lying about your food intake when you tell them like, no, I've like really tried everything and I feel like I eat really clean, but you still don't feel your best. That to me is like a classic scenario where we're not understanding how the conventional medicine model is very different from a functional medicine model when it comes to nutrition understanding and nutritional advice. Or let's even take like a weight loss out of the equation and think about maybe a scenario where maybe you're going in because you've had a lot of chronic bloating, chronic constipation, maybe some swings between constipation, diarrhea, like your gut just hasn't felt great. And you've gotten a referral to a gastroenterologist who did a complete GI workup on you. Everything came back peachy clean. He says you have IBS and you get handed a handout about a low FODMAP diet and a referral to a clinical registered dietitian who just tells you like what to eat and what to avoid. Like you're supposed to just like follow this diet like forever, this restrictive, like low fiber diet forever. But nobody's asking the question of like, that's interesting. Why do you have IBS? Right? Why can you not tolerate these foods? Right? So it's just a different mindset. And I'll share another very specific client example because I learn best through stories. So I'm always going to be a storyteller. But I had a gal come to me who had, and I think I talked about her previously a little bit, but she came to me, she had a history of gallstones. She had a more recent history of recurring kidney stones. So her primary care physician literally handed her a handout for a low oxalate diet and told her to follow it. She had an extreme trouble following the diet. She ended up gaining 35 pounds trying to follow this diet. And she called back in she asked for a referral to a nutritionist or someone that she could talk to about this whole diet situation because she was really struggling. She was having a hard time adopting it, having a hard time following it. She was really frustrated about the weight gain that it had caused. And they told her, the same ones that handed her this low oxalate handout, they're like, you don't need someone to talk to. Just follow the instructions on the sheet. How like dismissed, like denied. She actually asked for it. And she was like, when I called, why didn't someone refer me to someone like yourself? I'm like, I don't know what to tell you, right? So we have very different understandings and a lot of very frustrating experiences for people that are honestly waiting years or decades to get help. And it may be a while until they find somebody that actually has a more comprehensive view of nutrition. So those are just, like I said, some pretty obvious examples, but I think it's helpful to kind of dive in because we have two different models of healthcare. And so therefore we have two different mindsets and understanding and execution of even nutrition conversations. Okay. So the conventional understanding of nutrition is going to also follow the conventional mindset and toolbox in and of itself, right? So when we think of conventional medicine, their goal is to make sure that you're not dying and that you're surviving. Right? That is the ultimate goal. Their goal is to triage, stop the bleeding, manage your symptoms, right? So that's the toolbox that they're operating within. So a lot of times, even our more conventional medicine practitioners, fun fact, they usually get less than 12 hours of nutrition training in all of medical school. And even then, a lot of it is around like more of your triage kind of healthcare, right? So they're going to think symptom management. They are not trained to find the root cause, and that's okay. We don't need them to. We have a whole nother aspect of healthcare that is designed for that. But the conventional understanding of nutrition and pretty much the conventional experience that you're going to get around nutrition, I'm just setting expectations so that nobody feels disappointed or caught off guard or surprised when you have the same similar experience, is your conventional understanding of nutrition is going to be very much based off of dietary guidelines from your governing agencies of like the USDA, the FDA, going back to like recommended daily allowances values. So we have to understand that these recommendations are designed to outline nutritional needs, like the very basic nutritional needs that are required for you to not be dying. That's it, right? So it's like, are you getting enough calcium so you don't get rickets disease? Are you getting enough iron so that you're not anemic? Do you have enough folate so that you don't cause birth defects, right? It's like the nutrition mindset is just stop the bleeding, right? So another thing that you'll kind of get with that too is like symptom management, which is where they're going to just kind of fly in with some elimination diets. So, oh my gosh, you have IBS. Here's a low FODMAP diet. Or here is an AIP diet because you were tested positive for autoimmune conditions. Or like I said before, here's a low oxalate diet because you keep having reoccurring kidney stones. This is symptom management. This is not actually treating like, why do you have IBS? Why do you have food sensitivities? Why do you have autoimmunity? This is the mindset difference that I want you guys to really start to see, and why, like, I don't know, I just think that some people come in and they try to, they hate so hard on this conventional medicine side of things. And it's like, I get it. I get exactly why they have the toolbox that they do, because their mindset is, did I leave the patient alive? And are they meeting standards of, like, they're not dead, they're alive, right? It's like, that is the goal. Symptom management, triage the situation, stop the bleeding. So that is the toolbox in which they're operating out of 100% of the time. So once their toolbox runs out, it's okay to look for a different toolbox, because they are meant to handle nutrition for acute malnutrition states or like short-term health issues of someone that is on dialysis. What kind of diet does someone need to follow who's on dialysis? It's like, that is a very specific skill set. Or they're trained to help people that are on like feeding tubes in a hospital situation, right? That is the extent of their nutritional education. And that's great, because we need that. Hands down, we need that. But what happens is people are going into more of these conventional medicine spheres and they're getting that nutritional information, which to me, I'm like, well, yeah, of course they're going to talk to you about that, because that's their toolbox. That's all that they know. And then people are getting frustrated when they leave there and they're like, all my doctor talked to me about was taking my food and cut it in half. He slid me this handout for this low FODMAP diet and like upped my prescription of anti-anxiety medications. I'm like, of course he did. Like, that's his toolbox. That's all he has, right? And a lot of people, just like I said, find themselves more and more frustrated by that, because they are not understanding that that is exactly what that system is designed for. And if you're looking for something different than that system, you have to leave that system, okay? And so that's where more of what I would call like the other model of healthcare that we have access to, more of the functional medicine model, is thinking about nutrition totally different, right? I'm not going to band-aid your weight loss issues with a calories in, calories out conversation. I'm asking the question of like, why do you have uncontrolled weight gain in the first place? There's a reason for that. Right? Or I'm not going to band-aid your IBS symptoms with a low FODMAP diet. I'm asking, why the heck do you have IBS in the first place? I'm not going to band-aid your bloating and acne with a dairy-free diet. I'm going to ask, like, why do you have food sensitivities in the first place? Right? It's like, it's just a different mindset, because our role is now understanding nutrition to take someone from surviving to thriving. Whole different toolbox, whole different mindset. So now all of a sudden, we don't have to think like triage, stop the bleeding situation. We get to think, oh my gosh, maybe our body actually thinks about food in a whole different way besides just calories, because it does, right? So we get to come in and talk about things like, what about blood sugar? What about anti-inflammatory nutrition? What about incorporating the broadest diversity of food possible, not the most restrictive of foods possible? What about asking the question of like, what is the strategy to get off of this elimination diet? That is something I work with a lot of individuals on. It's like, okay, so right now you're not tolerating gluten or dairy or eggs or whatever it is. It's like, what's the exit strategy? How are we going to get you tolerating those foods again? We need to ask the question of what's going on in the gut microbiome. Why do we have some of those types of issues? So we're thinking bio-individuality, because there is not one diet that fits everybody. I'll tell you that right now. And if you walk into a nutritional provider's office and they are handing you cookie cutter handouts, kindly walk back out, okay? Because that is not how we practice nutrition. Or we're thinking more like root cause resolution. We're asking like, how are we going to use nutrition to address the underlying factors that are causing symptoms? We're looking for quality of food over quantity of food. I don't need you counting your calories and micromanaging your macros. That is not how our body thinks about food. We have to ask the question of like, how does my body digest and process food? And then also just full body integration, because yes, we have food coming in, but what about digestion? What about absorption? What's going on in the gut? All of those things have to be considered and very tailored to your plan. It's not just a take whatever you're eating and cut it in half. It is not a here's a handout for a restrictive elimination diet with no exit strategy. Like that is more of a mindset for a practitioner that is symptom management and trying to stop the bleeding. Whereas I'm thinking about getting you from surviving to thriving. So it's like, how can I improve your energy and your digestion and your hormone balance and your mental clarity? How can I reverse your IBS and put that into remission? How can I put your autoimmune patterns into remission? How can I correct your hormone imbalances? These are the questions that I'm using from food, not just, like I said, an elimination diet or a Band-Aid strategy. So just a couple, like, I guess more specific examples to kind of illustrate my point. Maybe if you think about the symptom of like fatigue, great one. Most of us kind of hear about that on a lot of our intake forms. Conventional medicine approach is probably going to come at you something, like I said, quantity oriented. They're like, well, are you eating enough protein? And you're sitting there and you're like, you really think I would have made an appointment with you if I was like not considering something like protein already, and they're like, oh, well, you probably just aren't eating, like take whatever protein you're doing and just double it. I'm not saying that protein isn't a viable conversation, but when someone comes to me with fatigue, of course we can think about protein, but also I'm thinking like, what does your blood sugar look like? What nutrients deficiencies do we have? What gut health issues are going on, right? Similar to something like weight loss, right? You go in and ask about weight loss, and classic conventional model, it's like, eat less, move more, count your calories and do more cardio, obviously. And you're like, okay, obviously I would have thought about that already and it's not working. So what do I do? My functional nutrition approach to weight loss is, where's the inflammation? Right? That is a very common piece of a weight gain puzzle, is like, where's the inflammation? What are hormones doing? How do we support metabolic function? Or maybe like gut issues. I've talked about that a couple times. Conventional medicine. Have you tried eating more fiber? Really? I've tried eating more fiber. That's your takeaway. What about drinking some more water, right? Whereas me, functional nutrition approach, I see gut issues and I'm like, what's going on in the microbiome? What's the balance of the commensals to more of our pathogenic strains? What's the status of the gut lining right now? What about stomach acid and bile production, right? It's like, it's just so different. It's a different mindset when you're thinking about taking someone from surviving to thriving versus just triaging or kind of stopping the bleeding. And some common myths that people think when it comes to nutrition, they think it's too restrictive or too complicated, when in reality, that's more of a conventional medicine mindset for sure. They're all about restrictive diets. They're all about restrictive elimination diets and cutting your calories and making it more complicated. It is not complicated. It is very much about abundance and personalization. And it's also not just for people that have chronic illness. Everybody can benefit from optimizing their nutrition. I talk all the time about blood sugar balance to people that do not have diabetes. You do not have to wait to have full-blown diabetes to start talking about blood sugar conversations. It's just wild to me, right? So in the reality, it's like very simple and sustainable changes and habits over time that make a huge difference here. So if this hasn't been something that you've considered before, of like, why do I feel increasingly frustrated by more of a conventional medicine mindset, even around nutrition and that whole toolbox, it's probably because you're looking for tools that will take you from surviving to thriving, and you're looking for nutritional advice in a model that's not designed for that. So you're just getting the wrong tools and therefore getting the wrong results. Okay. So hopefully like differentiating this was helpful for you. If you're interested in dipping your toes into what does that functional medicine approach look like, at least from my vantage point, I would encourage you to jump over to my website. You can get the link in my bio and jump into my Master Your Metabolism program. Okay. My Master Your Metabolism Masterclass was created exactly for this, for those functional nutrition foundations, so that you can start to understand food the way your body understands food. It's built out as a 6-week course. Each week builds on itself. And so I would highly encourage you to go over to my Master Your Metabolism course. You can download it instantly. You can get started today, and it will really get your feet wet and like blowing your mind behind what we've been taught about food and what's really true for our bodies. So hopefully you guys enjoyed that. Come back next week for more episodes of Learn with Lo.